Arkansas cable providers are connecting our state to the world. Through our state-of-the-art broadband networks, educators, healthcare providers, emergency responders, law enforcement personnel, and consumers have access to the information superhighway like never before, many times at greatly reduced costs. That's our commitment to making Arkansas a leader in the digital age. Arkansas cable providers are indeed connecting our state to the world, and we're just getting started.
You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
And welcome back to Capitol View. I'm Roby Brock. All throughout 2014, we're going to introduce you to as many candidates for the most talked about races, provide you with an opportunity to get to know some of these people you're likely to see a lot over the next several months. And so joining me this morning to discuss the 4th Congressional District race is State Representative Bruce Westerman. He's the House Majority Leader. He is seeking the Republican nomination for the 4th Congressional District from Hot Springs. Welcome to the program.
Good morning, Roby. Thank you for having me here.
Why Congress? You had another term left on your state legislative career here, so you could have run again. The House Republicans have the majority for the first time since Reconstruction. What made you possessed enough to go run for Congress?
Well, I don't think Congress is going to change on its own. We need good people to go to Washington to work for the changes that we needed. I got my political start on the school board, and I saw a lot of things that were pushed down to the local level from the state, so I came to the state, and now I'm seeing a lot of things that are pushed down on the state from Washington. So maybe I'm going to go to the source this time.
Well, you know, if that's the case, then it may come from the White House eventually, so you're not planning to run for president anytime
Not
soon.
anytime soon.
All right.
Yeah.
I think one of the first things that you might be asked to vote for if you are elected to Congress would be for the Speaker of the House. John Boehner leads the Republicans right now. Would you cast your vote for John Boehner for Speaker of the House?
Well, a lot of things could change between now and then. I have not met Speaker Boehner yet, so I would reserve my comments on who I would vote for Speaker of the House. I'll wait and see who's there and who's running and all that when that comes around.
And those choices.
Right.
Let's talk about fundraising. You raised a little over $110,000 in the third quarter, which was your first kind of full-fledged quarter of being able to run. I'm not sure, were you in there for the whole third quarter or just part of it?
No, just part of the third quarter.
So
about a month
you're
and a half.
probably not going to tell me today where you stood on your fourth quarter fundraising, but higher or lower than $110,000?
The report will come out at the end of the month.
Oh, that is such a politically correct question. So
yeah, we were pleased. We met our goal again, so we were pleased with our fundraising.
Fourth quarter harder to raise money than the third quarter?
Absolutely harder.
Tell me a little bit about that.
Thanksgiving and Christmas there. I think a lot of people's focus turns away from politics as maybe as it should with getting together with family and celebrating the holidays.
Let's talk about some issues that are surfacing in, I guess, nationally in terms of congressional politics. Just this week, we've seen kind of a renewal of Republican interest from Representative Paul Ryan about the immigration issue, says that there may be something coming on that front. Is that an issue you're hearing much about when you're traveling the 4th Congressional District, or is there a more pressing issue?
Well, the most pressing issue that I hear about everywhere is Obamacare, but I have heard a few comments about immigration reform while traveling through the 4th District.
What do you think is the problem in terms of immigration policy right now in the state of Arkansas, or in the nation? In
the nation, I think it gets more back to controlling access, securing the border, and enforcing existing laws and controlling access.
You say you've heard a lot about Obamacare. Obviously, that has been a hot topic. We released some poll numbers earlier that showed that really the economy and jobs are the most important issue that Arkansans are facing. 55%, only 16% identified health care as the most important issue facing Arkansans. Why is there not more emphasis from folks that you're hearing, do you think, about the economy and jobs?
Well, I believe Obamacare affects the economy and jobs. It's another top-down regulation from Washington, D.C. that creates uncertainty in the marketplace, and it's just another example of the regulations and the centralized control coming out of D.C. that I think affects not only health care, but it affects jobs as well.
I want to pull up a graphic here. I think we've got something that's a quote from your website here. As the first Republican House Majority Leader since Reconstruction, I was proud to lead the fight for liberty in Little Rock and cast a no vote every time a plan to expand Obamacare or spend another taxpayer's dollar on this failed program came before me. Was there anything good that came out of the federal health care law?
Not that I've seen so far.
You don't think that allowing students to stay on their parents' plans till 26, or the no pre-existing conditions? Is that not a good outcome from the law?
I think if you look at the Affordable Care Act, as it's called, in whole, there's much more wrong with it than there is good. So no, I really don't see a whole lot of good out of it.
So you're from probably the perspective it should be repealed and replaced, not reformed?
Right.
If you've got some of those good elements in there, though, that you've identified, that there are some good elements in there, doesn't that lead it to be easier to reform it than it would be to repeal it?
I think we need to get rid of it and start over. I think that's the same argument that we could look at on the state level with the private option, that I think we would be wasting effort to try to reform what's in it, and we need a system that's based on real healthcare reform and not just regulations and things that are about stuff other than healthcare.
So what does real healthcare reform, as your kind of understanding, what does that mean?
I think we need to look at programs that are what Medicaid was originally intended for, the aged, the blind, and the disabled. If we're going to have a government healthcare assistant program, we need to focus on those folks first. We need to look at reforms that are more market-driven, reforms that give states more flexibility. For true Medicaid reform, I think the only way to really do that is to get a global waiver and to get a block grant from the federal government so that the state can design its own program and run that more efficiently.
Isn't the private option somewhat a state-designed program, though? I mean, I know you were involved in those negotiations in the regular session early on before you decided not to be a part of that plan, but the private option is kind of a state-designed plan that Arkansas had a lot to say.
It's still under a lot of federal control and regulation, though. I was part of a working group that was working towards Medicaid reform, and we passed a lot of good Medicaid reforms in the last session. We got the Office of Inspector General, Medicaid Inspector General, which every day is saving money by stopping waste, fraud, and abuse, and it's able to provide better services for those people who really need it. We passed reforms that allowed better access to care for Medicaid patients at a lower cost to taxpayers. So those are the things that I was really working for on that working group. The private option, I've never been a supporter of what came out in the private option.
There won't be a chance to change that policy in a major way in this fiscal session because you can't deal with those types of bills like you did in the regular session, but there can be special language written into some of this. Is there anything that could persuade you to improve the private option that could be done in this fiscal session?
I think when we talk about the private option, first we have to look at the premise of the private option. And if you accept the premise that it's good to implement Obamacare through the private option or Medicaid expansion, to put another 250,000 people on a government health care program at a cost of $2 billion per year, if you accept that premise, then you look at the private option as a way to do that, then you could start talking about whether we reform the private option. But I reject the premise that we should be putting an additional 250,000 people on government health care and spending $2 billion a year to do that.
Well, the question goes, where do those people go? But I'm told that we are out of time, so we'll have to continue this policy discussion at a later date. He's Bruce Westerman. He's running for the 4th Congressional District. He's also the House Majority Leader. Thank you very much for being with us.
Thank you, Roby, anytime.
All right, we'll be back with more Capitol View right after this. I'm Roby Brock. You have the Capitol View on Sunday morning on KARK.